So today we're going to talk about oligospermia and an herb called Ren. Ren. And a little bit about oligospermia. That's the technical medical term for low sperm count. So a lot of times men come across this issue when they're getting evaluated for infertility. And when a man is getting evaluated for infertility, they have to give a sperm sample. They check for numerous things in a sperm sample, including the count of the sperm per milliliter, as well as the motility and the volume. But one aspect of it is the sperm count per milliliter. And typically, the lower threshold is considered 15 million per ml. And so if you have less than 15 million per ml, that is considered a lower sperm count, and the technical name is oligospermia. And so that could be related to infertility and why you may be having difficulty with infertility because you don't have enough of a concentration of sperm in the semen. And so that is one of the causes. And like I said, they also will check the motility of the sperm, how well it's able to move, and then the total sperm counts. Now, in Western medicine, your doctor may want to do other testing to see what may be attributed to it. But in Chinese medicine, one of the key things with low sperm count and even poor sperm motility or just in general low counts, it's oftentimes related to the kidney. In Chinese medicine, the semen and the testicle function is very closely tied to the kidneys. And so to have any kidney problems most likely has some root in the kidneys as well. Any problems with the sperm or semen. And so one of the things that we will typically do at our clinic is evaluate whether you're having any sort of kidney symptoms. So other symptoms of kidney problems might be weakness in the knees or in the lower back. You might feel cold easily. You might have problems with urination. Either you feel like you have to go urinate frequently, or you wake up at night to go urinate a lot. You may have trouble controlling your urine. You may have problems with erection. Those are also related to kidneys. And so a lot of different things can be contributing to kidneys and related to kidney problems. Feeling cold, like I said, dry mouth, feeling thirsty. Those are all symptoms related to kidney deficiencies, kidney weakness. We typically classify kidney problems under a few different categories. There's kidney yang deficiency, then there's kidney yin deficiency, there's also kidney qi deficiency. And then depending on whether there's problems with the kidney in relation to other organs, you could have combinations. So for example, if you have a kidney problem and a heart problem, you could have kidney heart disharmony. All of this is to say that you need to have a doctor who's going to know how to evaluate not just which organ it is, but what the actual problem within that organ is. And so when we talk about kidney problems, one of the herbs that I wanted to just bring up today is an herb called Ren. Ren, and in English this is the black cardamom. And this is a herb that is used in Chinese medicine, which really helps with tonifying the kidney yang. And the kidney yang is kind of like the life energy of the kidney. And like I said, we have to differentiate whether it's a problem of kidney yin or yang or kidney qi or an interrelated organ problem. But for kidney yang problems and kidney yang weakness, Ren is a herb that can help to tonify the kidneys. And it's actually in the Chinese medical literature especially useful for problems with sperm dysfunction. It helps to strengthen the kidney yang, and it helps to tonify the kidney essence, both of which are crucial to have good sperm function. And so this is an herb that sometimes we use in cases of oligospermia or low sperm count. And it's an herb that can tonify and build up the kidney yang and build up the reproductive ability of your body when it's used in the right scenarios. And so that's a little bit today about oligospermia and how we look at it from a Chinese medicine perspective, and an example of an herb that we might use at our clinic for our patients in this scenario if the symptoms and the diagnosis and the treatment all match up. And we'll see you next time. And thanks for joining us today.